Bismillahirrahmanirrahim. The topic we are discussing is Polycystic Ovarian Syndrome. What is PCOS? It is a condition that affects a woman's hormone levels. Women with PCOS produce higher than normal amounts of male hormones. This hormone imbalance causes their body to skip menstrual periods and makes it harder for them to get pregnant. PCOS affects a woman's ovaries, the reproductive organs that produce estrogen and progesterone, hormones that regulate the menstrual cycle. The ovaries also produce a small amount of male hormones called androgens. The function of the ovaries is to release the egg to be fertilized by a man's sperm. The release of an egg each month is called ovulation. Follicle stimulating hormone and luteinizing hormone, which are produced by the pituitary gland, control ovulation. Follicle stimulating hormone stimulates the ovary to produce a follicle, a sac that contains an egg, and then LH triggers the ovary to release a mature egg. PCOS is a syndrome or a group of symptoms that affects the ovaries and ovulation. Its three main features are cysts in the ovaries, high levels of male hormones, irregular or skipped periods. In PCOS, many small, fluid-filled sacs grow inside the ovaries. The word polycystic means many cysts. These sacs are actually follicles, each one containing an immature egg. The eggs never mature enough to trigger ovulation. The lack of ovulation alters level of estrogen, progesterone, FSH and LH. Progesterone levels are lower than usual while androgen levels are higher than usual. Extra male hormones disrupt the menstrual cycle, so women with PCOS get fewer periods than usual. As we can see in this picture, on the right side we have a polycystic ovary and on the left side we have a healthy ovary. This picture also shows the normal ovary and the polycystic ovary. On the right side we have a normal ovary and on the left side we have a polycystic ovary in which we can see the cysts. Types of PCOS. Insulin resistant PCOS. This is the most common type of PCOS affecting around 70% of the people. Post pill PCOS. Post pill PCOS occurs in some people after they stop taking the oral contraceptive pill. Adrenal PCOS and inflammatory PCOS. Causes of PCOS. High levels of male hormones prevent the ovaries from producing male hormones and making eggs, normally genes. Studies show that PCOS runs in families. It's likely that many genes, not just one, contribute to the condition. Insulin resistance. Up to 70% of women with PCOS have insulin resistance, meaning that their cells can't use insulin properly. Insulin is a hormone the pancreas produces to help the body use sugar from foods for energy. When cells can't use insulin properly, the body's demand for insulin increases. The pancreas makes more insulin to compensate. Extra insulin triggers the ovary to produce more male hormones like androgens. Obesity is a major cause of insulin resistance. Both obesity and insulin resistance can increase your risk for type 2 diabetes. High levels of androgens, high levels of insulin and obesity, heredity, low-grade inflammation are the causes of PCOS. Symptoms of PCOS. Irregular periods. A lack of ovulation prevents the uterine lining from shedding every month. Some women with PCOS get fewer than 8 periods a year or none at all. This condition is known as oligomenorrhea. Heavy bleeding. The uterine lining builds up for a longer period of time, so the period you do get can be heavier than normal. Hair growth. More than 70% of women with this condition grow hair on their face and body, including on their back, belly, and chest. Excess hair growth is called hirsutism. Acne. Male hormones can make the skin oilier than usual and causes breakouts on areas like the face, chest, and upper back. Weight gain. Up to 80% of women with PCOS are overweight or have obesity. Male pattern baldness. Hair on the scalp gets thinner and may fall out. Darkening of the skin. Dark patches of skin can form in body creases like those on the neck, in the groin, and under the breast. Headache. Hormone changes can trigger headaches in some women. As we can see in this picture, there are some symptoms of PCOS like excessive body hair growth, weight changes, ovarian ovarian cyst, low sex drive, irregular or missed periods, male pattern baldness, high testosterone levels, insulin resistance, fatigue, acne, mood changes, trouble conceiving, or infertility. These are some of the clinical features of PCOS: ovarian cysts, hyperinsulinemia, endocrine dysfunction, obesity, hyperandrogenism. How PCOS affects the body. Infertility. To get pregnant, you have to ovulate. Women who don't ovulate regularly don't release as many eggs to be fertilized. PCOS is one of the leading causes of infertility in women. Metabolic syndrome. Up to 80% of women with PCOS are overweight or have obesity. Both obesity and PCOS increase your risk for high blood sugar, high blood pressure, low HDL, good cholesterol, high LDL, bad cholesterol. Together, these factors are called metabolic syndrome, and they increase the risk for heart disease, diabetes, and stroke. Sleep apnea. This condition causes repeated pauses in breathing during the night, which interrupt sleeping. Sleep apnea is more common in women who are overweight, especially if they also have PCOS. The risk for sleep apnea is 5 to 10 times higher in women who have both obesity and PCOS than in those without PCOS. Endometrial cancer. During ovulation, the uterine lining sheds. If you don't ovulate every month, the lining can build up. A thickened uterine lining can cause increase your risk for endometrial cancer. Depression. Both hormonal changes and symptoms like unwanted hair growth can negatively affect your emotions. Many with PCOS eventually experience depression and anxiety. As we can see in this picture, on the right side we have a normal ovary, where after the ovulation, corpus luteum and corpus albicans are formed. And on the left side, we have a polycystic ovary where primary follicles developed and their development stopped. If their development stopped, then there would be multiple immature follicles which can lead to the condition of PCOS. जैसे कि हम इस अल्ट्रासाउंड पिक्चर में देख सकते हैं कि राइट साइड पे हमारे पास एक नॉर्मल ओवरी है और लेफ्ट साइड पे पॉलीसिस्टिक ओवरी है जहाँ पे काफ़ी सारे सिस्ट बने हुए हैं। पीसीओएस की डायग्नोसिस कैसे करेंगे? इसके लिए हमारे पास बायोकेमिकल और क्लिनिकल हाइपर एंड्रोजिनिज्म होती है, जिसमें इंक्रीज प्लाज्मा एंड एंड्रोजन लेवल्स होते हैं, हिर्सुटिज्म होता है, एक्नी होता है, हेयर लॉस होता है। दूसरी कंडीशन में, दूसरे डायग्नोसिस में ओलिगोमेनोरिया होता है, जिसमें अक्सर ये कंप्लेन होती है कि जो रेगुलर मेंस्ट्रुअल साइकिल है वो डिक्रीज हो गई है, मंथ स्किप कर गए हैं, फ्यूअर देन 8 साइकिल्स पर ईयर। पॉलीसिस्टिक ओवरी मॉर्फोलॉजी. Enlarged ovaries with increased stroma associated with greater than 20 follicles per ovary using a transvaginal probe and high resolution technology. The treatment for these conditions can be lifestyle changes, physical activity, or reduction of total calorie intake. Estroprogestins, preferring estrogen, and association with an anti-androgenic progestin could be advisable. इंसुलिन सेंसिटाइजर और हाइपरइंसुलिनीमिया की कंडीशन में मेटफॉर्मिन एंड आइनोसाइटोज को प्रिस्क्राइब किया जाता है। इफ लाइफस्टाइल, एस्ट्रोप्रोजेस्टिन्स, इंसुलिन सेंसिटाइजर्स does not give you any proper results, then we also use anti-androgens. In common medical treatments, we can use birth control pills, metformin, clomiphene, surgery, and diet. Diet and weight reduction can be ideal treatment for PCOS. Some snack ideas for PCOS are described in this picture. Some best natural foods to cure PCOS or PCOD can be amla, cinnamon, jeera water, flaxseed, and tulsi. This flow chart can be helpful in PCOS to maintain your healthy diet. PCOS को हम इस एक स्लाइड में समराइज कर सकते हैं सिम्टम, डायग्नोस्टिक टेस्ट, ट्रीटमेंट के साथ। पॉलीसिस्टिक ओवरी की कंडीशन में फर्टिलिटी ड्रग्स यूज़ की जा सकती हैं, वेट रिडक्शन टेक्निक यूज़ की जा सकती हैं। इरेगुलर पीरियड्स में बर्थ कंट्रोल पिल्स यूज़ की जा सकती हैं एंड फर्टिलिटी ड्रग्स भी यूज़ की जा सकती हैं। हिर्सुटिज्म की कंडीशन में ऑरल कॉन्ट्रासेप्टिव एंड इंसुलिन सेंसिटाइजिंग मेडिकेशंस को यूज़ किया जा सकता है। इरेगुलर ओव्यूलेशन और रिड्यूस फर्टिलिटी में आईवीएफ स्टिमुलेशन ड्रग्स को यूज़ किया जा सकता है। ओबेसिटी, रैपिड वेट गेन, डिफ़िकल्ट टू लूज वेट में लाइफस्टाइल की चेंजिंग एंड डायबिटिक ड्रग्स को यूज़ किया जा सकता है। थैंक यू।